Effective communication improves patient satisfaction, it decreases patients' emotional stress, it improves treatment adherence and compliance, it improves health outcomes, it reduces medical errors and malpractice, and it improves physician satisfaction. This has been well documented in a variety of studies. And when you look at communication skills specifically, there's no question that we all think we are great communicators. But the reality is, good communication skills can be taught. Moderate communication skills can be improved. It's no different than a medical procedure and how skills are learned. We pay very close attention to the medical literature for our specialties because we want to be on top of our game. We want to make sure that we're offering the best treatment options and that we know the best opportunities to treat patients' illnesses. Medical communication and how we structure our practice encounters in the office and also on the medical floors can also be improved by paying attention to good process. It also must be practiced. We can't assume just because we read an article about how to improve our medical communication skills means that we can walk out and apply it. It's a skill, and like any other skill, whether it's me trying to improve a specific operation or a procedure, you have to practice it to get facile at it. Mastery also requires deliberate practice and feedback. It's important to listen to your patients. One of the most powerful metrics that we use are verbatim comments from patients. A lot of people look at me and say, what good are verbatims? It's nothing more than anecdotes. But I can tell you with certainty that a patient or a provider can be in the 90th percentile for communication, but they can also receive a lot of complaints. And if you look at a provider's complaints and the theme happens to be that they don't see the patient after surgery, I'm pretty sure that a handful of anecdotes like that really informs on the practice environment and how it can be improved. So it's important to pay attention to what our patients are saying because it makes us better providers and it can really inform us on how to be better at organizing a more efficient interaction with our patients. A couple summary tips on what we have found helps to improve communication scores in our environment. Introduce yourself. Let the patient know that you are in charge of their care. Think back to my patient who had the rectal cancer and the number of different people that interacted with her during her 5-day hospital stay. What patients complain about the most, again verbatims, but an awful lot of verbatims, is they often don't know who is the captain of the ship. They want to know because it reduces anxiety and it improves their comfort level. They want to know that you're in charge, that you're making the decisions, that you know what's going on. So tell them that. Make sure that they understand that you're looking out for them, that that's your responsibility. Include nursing in your care plan. Often I'm amazed at how physicians don't cooperate or don't communicate with the nursing teams at the bedside. Your nurses at the bedside or in the office are your best advocates. They are your partners, and they can do more good to help you manage your practice efficiently, help you take care of those patients on the floor. They can mitigate confusion. They can help patients understand plans. So I encourage you, which is what we do for all of our physicians in our organization, to spend time with your nursing teams. Get with them at the bedside. Make sure that they understand what you're doing for the patients and what the plan is. Because when the patient needs to talk to you and you're not available, or if you practice in an academic environment where you have residents and fellows, and often the communication schemes don't match with what you've told the patient or what the fellow or the residents have told the patient, the nursing team can really help to help make the patient understand what the plan is and how things are connected together. So make them your partner. They are your best friends when taking care of patients. Explain the plan. And it's not just enough to tell the patient what the plan is. Often patients don't remember. Another study we did very informally when I first took on this role is I went in and I talked to patients, I told them the plan, and then I would leave. And then about 20 minutes later, I'd have a medical student go into the room. And that medical student would ask the patient, what did Dr. Merlino just tell you? And most times, patients could not remember. So it's really important to not only explain the plan, but ask the patient if they can repeat the plan to you. This concept of talkback is really important, and what it does is it engages the patient. It makes them a partner in their care because you want them to be engaged. You want them to be able to repeat the plan to you because what that shows is that they were listening, they do understand. If maybe the patient is not available to be up on repeating the plan, utilize a family member or a friend at the bedside. Again, finding an advocate that can help communicate with the patient is very important. Answer questions. We all walk into the room and say, do you have any questions? And I think we're always amazed at how little questions patients actually have. But what you find, again, same medical student, when you go back into the room 15 or 20 minutes later and say, do you have any questions now? It's amazing how many questions the patient suddenly comes up with. So make sure that they really understand if they have any questions and give them the opportunity to ask them. You want the patient to really be able to repeat what's going on, because that's an indication that they not only understand the plan, but you reduce the incidence of unanswered questions. Make sure your team is aligned. I gave you the example of how nursing can be your partner at the bedside. Again, if you're in an academic environment, or even if you're in private practice and you're working with physician extenders or other people or other consultants, make sure everybody understands what the plan is. The last thing you want, which is what happened to me last year, is my fellow walking in to see my patients at 6 o'clock in the morning, taking the PCA off, putting them on oral narcotics, giving them a diet, and then not calling me, and when I go into the room at 1 o'clock, they're throwing up, they don't feel well. It shows that we're disconnected, we're not coordinating, nobody's in charge. Make sure that the residents, the fellows, your PAs, your clinical extenders, whoever you work with to help drive care, understands that we're all in this together to deliver the best care for patients. And we don't make decisions independently, and that's a very important message for fellows and residents. We make them as a team, and that they should talk to you before they inform the patient of a change in the plan. Because again, it's not the resident or the fellow that will be measured on their communication skills. It's you. What they do will impact you. Finally, an important tip is to meet before discharge. I gave you the example earlier on the disconnection that patients often have right before they're discharged. It's important that patients understand the plan, and that you, as the ambassador of their care, asks them before they leave that they understand everything, that they don't have any questions, and that you're available for them, or your office is available for them if they need you. I want to thank you for giving me the opportunity to talk to you about patient experience. I hope I've convinced you that this is a very important topic for all physicians across the United States, but also across the world. Make no mistake, we are judged today on things we were never judged on before. And it's not only the judging that counts, but these metrics we're being held accountable to different metrics today, and they're being tied to things like transparency, our information on the internet. They're being tied to reimbursement, how much we and our organizations get paid based on our performance. It's no longer just good enough to provide high quality, safe care. We must also ensure that we're delivering a great patient experience. It is the current environment that we're practicing in, and I think we could all agree it's the right thing to do, and it's the way we would want to be treated. Again, thank you very much for the opportunity to talk to you. Have a good day.